Good evening, and welcome to another edition of the Rankin Mon Valley, the Pittsburgh section of the National Council of Negro Women. My name is Patricia Blewett, and I am the section's corresponding secretary. And joining me is Alice Paylor Days, and Alice is a member of the section's political party. We thank all of you who have participated in our previous programs and hope that you will join us again today with your questions. Now, you can call your questions in by dialing 412 853 8206. Our guests today are from the National Council of Negro Women. Good Health Wins, the Women's Immunization Network program. Zenobia Moss is the National Project Manager, and Dr. Rosalie Smiley is from the Rankin Mon Valley Pittsburgh Project Director. The program today satisfies one of the National Council of Negro Women's mandates to educate African American women and their families about health and access to health care. Today's program will also support the Ncnw Good Health Wins, the Women's Immunization Network initiative, and the CDC, which is the Center for Disease Control, Bridge to Access programs. Now, before we begin our show, we want to introduce to you our guests by reading their bios. Miss Alice, would you like to read the bios, please?
Yes, I'll read the bio of Dr. Rosalie Smiley. Dr. Smiley holds a doctorate in philosophy and social work and a social work master's degrees in social work and public health, as well as a home and school visitor certification. Dr. Smiley is licensed to practice in the state of Pennsylvania. Dr. Smiley's social work career has been with families, children, and youth in the juvenile justice, child welfare, educational, community-based residential services, foster care, independent living, substance treatment, and intervention program services. As a trainer, she has provided professional workshops and training in organization leadership, trauma-informed services, sanctuary model, diversity, and mental health, just to name a few. She is busy. Welcome, Rosalie, and thank you for being on our program. And the next bio I will read is Zenobia Moss, who's the National Project Manager. Let me see the information. So welcome, ladies, to our show, and we'll have a good show tonight.
Well, let me go ahead and read Miss Zenobia's bio. Zenobia Moss currently serves as the National Project Manager for Good Health Women's Immunization Network, the Good Health Wins, to help manage the pandemic responses for 40 national organizations with a reach to 4.5 million African Americans. Previously, Zenobia was a global strategic advisor for the Brain Matters Early Learning Global Network, which launched in 27 countries across 4 continents. Zenobia also served as the program director for the Child Advancement Network at the Clinical and Translational Science Institute at the Medical College of Wisconsin. Zenobia is highly skilled in translating science into related program policies and effective messaging, driving collective impact. Welcome, Zenobia, and thank you also for being on our program today.
Thank
Well,
you.
you're
Happy to be
welcome.
here.
Oh, I'm glad you both could come in. Now we're going to go with the first question. The first question: what is the purpose of the Good Health Wins program? Either one. You can just start
Well,
if you have
first
anything
of
to
all,
add
let me
to it.
say thank absolutely. Thank you so much to the Rankin Mon Valley Pittsburgh section of the National Council of Negro Women, and a special good evening to my sisters, Patricia, Alice, Kathleen, Dr. Smiley. What a wonderful way to spend a Friday evening, because we know that what we're going to be talking about today is still real. COVID is still amongst us. So the purpose of the Good Health Women's Immunization Network, but now we affectionately call it Good Health Wins because we have a lot of fraternities and men involved with our work. Good Health Wins program, it's very multifaceted. We aim to primarily improve health or vaccine equity by increasing vaccination confidence and uptake among underserved communities. So the initiative seeks to provide reliable, evidence-based information about vaccines to combat misinformation. And we really work to emphasize the importance of vaccines or immunizations across the lifespan. So by doing so, we are able to address the historical and systemic barriers that have contributed to health disparities. One of our core objectives of Good Health Wins is really centered around community engagement. And so it takes information and education like we're doing tonight. So we work closely with local leaders, healthcare providers, and community-based organizations or CBOs to tailor outreach efforts to the unique needs of each community. So like you all are focusing around Pittsburgh. This CBO approach has been very successful in helping to ensure that the information and services provided are culturally relevant and accessible through thousands and now millions of trusted messengers.
Oh,
Thank you.
that sounds like an excellent program. What year was the Good Health Wins initiative launched, and how did you become the project manager?
Well, thank you for asking. So NCNW, National Council of Negro Women, we have always been at the forefront of addressing issues pertinent to things going on in our country. So with our mission to lead, to advocate, and empower women of African descent, our families and communities, if you think back to early 2020, 2021, at the
Mhm.
onset of the pandemic, it was a
Mm.
critical time when the world was really grappling with COVID-19. We didn't even know what it was. We didn't know what was before us. And so the urgency to increase vaccine confidence and uptake was at an all-time high, particularly among communities disproportionately affected by the pandemic. And so the initiative was designed to address these urgent needs by leveraging community voices, the trusted community voices, and these extensive networks that CBO organizations have to disseminate accurate information around vaccines and facilitate vaccination services. So it was program, information, and services. So I would say that NCNW, we've always been committed to this kind of work. We say at Good Health Wins, we're better together. I became the project manager for Good Health Wins through a combination of my professional experience and personal commitment to public health. But if we roll back a little bit more before that, we launched Good Health Wins under our current chair, under our chair then, Dr. Janetta Besh-Cole. But we've kind of fast forwarded. We continue to be committed to the health issues through our leaders like Dr. A. Lois Keith, our board chair, and our president and CEO, Reverend Siobhan Arline Bradley. They're both public health champions. So this is kind of who we are. My background, although it's in public health programs, community outreach, health education, I like to lead initiatives that focus on improving health outcomes in underserved communities, which provided me with this very unique opportunity to run and have oversight over the Good Health Wins program. But it's all of us together. I don't do this work alone. As project manager, we have 42 different state and national organizations that are a part of Good Health Wins. And so each has a project manager with a team of 5 people. So it is a very complex organization, but it is just not me by myself. So I can't take myself.
Okay. Now, does the Good Health Win program only serve African American women and their families?
So no. So while Good Health Wins, the program was initially formed on addressing and really through the lens of African American women and their families, um, we would say that in the beginning we really wanted to look at what were the historical health disparities and the high level of vaccination within these communities. But we quickly saw that Good Health Wins had to be a combination of of a reflection of all communities. So our very inclusive approach helped us to expand our reach. The program is dedicated to serving all underserved and marginalized populations, recognizing that health inequities affect a wide range of communities. And so, you will see that we have about 2,000 mini grants that are currently going on across the country. And this inclusive approach, it works with all kinds of diverse groups. So including Hispanic, Native American, Asian American, and other minority groups, as well as rural populations. So our primary goal is to ensure that everyone has access to accurate health information and vaccination services, regardless of their race, ethnicity, or geographic location. And by collaborating with this very broad spectrum of community-based organizations, Good Health Wins, we're able to tailor our strategies to meet the needs of the specific communities that each mini grant recipient is serving.
Thank
Oh,
you.
that's good. Well, what is the relationship between the Good Health Wins program and the Center for Disease Control?
So the CDC, so our relationship between Good Health Wins and the CDC is one of collaboration and support. So the CDC provides essential funding, resources, and expertise that enable Good Health Wins to carry out its mission effectively. We are now in the fifth year, going into the fifth year of a 5-year commitment with the CDC. We have
Oh,
been
good.
provide over $20 million in grants to groups and organizations across the country. So those being our state organizations, some going to our national affiliates, we have national partners, but most importantly, we've been able through this grant to work with the entire Divine Nine organization or the National Panhellenic Council. So you look at the reach of Ncnw with approximately 2 million within our Ncnw framework, and then partnering with the National Panhellenic, we now have outreach to 4.5 million African Americans. So it has grown tremendously. The CDC, as I said, provides funding, resources, expertise. Their involvement is crucial for several reasons. First, it is essential that as we provide this information, that it has a scientific backing necessary to develop accurate and effective health messaging. So foremost, we look to the CDC for their guidance around data and research to help inform the work that we do on our educational materials and outreach strategies for Good Health Wins. But also the CDC resources have enabled us to scale the program's initiative beyond our state and national organizations. So for example, we have 2,000 mini grants going on right now in about 10,000 zip codes. We have about
Wow.
6,000 partners. So that funding has enabled us to really scale this nationally as this program is done within the contiguous United States. And then I would say the other thing
That's excellent.
it does is
That
it
is.
helps it really helps us, our program, to have capacity to really look at data on the ground, but to improve vaccination rates, build vaccine confidence, and ultimately positively to impact health outcomes in the country.
Okay. What are some of the
That's good.
major focus areas of the Good Health Wins program?
Well, we do a lot, as I said, so, but I would say if there were kind of buckets of work, it would be one, vaccine education and awareness. So a key focus
Okay.
area is providing evidence-based information about vaccines. So our programs and events across the country help to develop and disseminate those educational material, and literally in the hundreds of thousands, when we think about how many people we're able to impact. Another key area that we do is community engagement. So we utilize as trusted CBO organizations such as NCNW and our national affiliate. We really work to build trust within communities for essential. And I think that this trust is really essential for the success of the program. I mean, we really
Mm-hmm.
partner with other local organizations, community leaders, influencers, who are trusted by the community. And so that partnership is what helps to create a more personable and relatable connection. And that makes it easier to disseminate the health information and encourage vaccinations. Also, we really focus on accessibility, ensuring that vaccines are readily available to underserved populations. Is another major part of our focus. So, making sure that people know where to get vaccines, how to access vaccines, et cetera, and then where to get information about vaccines. And we do that by addressing barriers. So, early on in the pandemic, we had partnerships with Uber where we help provided transportation, getting
Oh,
people to vaccine
Okay.
spaces.
Good.
We say in Good Health to Win, this is a +1 grant, which means you don't do the work by yourself. You're always doing it with another group or organization. So whether it's schools, Boys and Girls Club, churches, anyone that you are doing public service work for, we ask that you blend or overlay Good Health Wins messaging to what you were already going to do. So if you're addressing social determinants health, if you're addressing other comorbidities like diabetes or cancer or hypertension, things that are really that resonate, we have high numbers in our community. We ask that you include vaccination immunization messaging with those programs and events that you were already going to do. And then I would say, lastly, our biggest focus is around data and research. Collecting and analyzing data is essential for understanding community needs and measuring the impact of the program's interventions. So we're very, very data driven. All of our subrecipients in the grant, they report into Ncnw. So, by focusing on all these areas, we're really able to provide a really comprehensive approach to how we build vaccine confidence and uptake in the country.
Okay.
okay. Well, you're really spread out. So, what are some of the challenges that you've had, that you've encountered in setting up the Good Health Wins programs across the country?
Well,
I know you've had some.
excuse me, I would say there definitely have been challenges. If you think about where the country has been years, especially at the onset of the pandemic, we didn't know. There was a lot, and we just all had to grow into this together. Of course, we had to overcome vaccine hesitancy. That was one of the most significant challenges that we had to overcome. Many
Mm-hmm.
communities and underserved populations, we have deep-seated mistrust in the healthcare system due to historical injustices, ongoing disparities. And so we wanted to make sure that we address this mistrust, which we really require building genuine relationships and engaging with community leaders who can help advocate for vaccinations and immunizations. And then what we did with Good Health Wins, we actually broadened it. So we started off with COVID, and then we talked about the importance of flu. And now we've positioned our work to talk about the importance of vaccines across life.
Mm-hmm.
We've had to tackle misinformation. There was a proliferation of misinformation, particularly on social media, and that's been a major hurdle. Also, information about vaccines. You heard all the rampant stories. That was absolutely, amazing, but sometimes difficult to counteract. And so, we do this. We counteract it. We have a free certificate program where people can come and learn about what does it mean to be a trusted messenger, how to handle misinformation, disinformation, how do you continue to advocate for this space. And so our goal is to really provide clear, accurate, evidence-based information. We had to overcome language and cultural barriers.
Mm-hmm.
That was in the beginning. And of course, it helped that we had the resources from the CDC because there were resource limitations. So remember, during the pandemic, in order to get the country to herd immunity, we had to do some exceptional kinds of things. So you
I'm
saw
sure.
farmers able to
Mm-hmm.
provide vaccines. You saw mobile vaccine clinics. You saw faith-based organizations, everybody opening up their parking lots. It was just a great example of what happens when we all come together. And that's why we say at Good Health Wins, we're better together. And then we had to be able to adapt to the needs of the people. So you saw there were late hours that vaccine, you can literally at the beginning get vaccines 24/7. There were mobile clinics. And so we really wanted to look at what are the unique strategies and priorities, and that we had to shift and continue to adjust, so that we could be responsive and stay true to what the needs of the community were. So, but the good news is, despite these obstacles, this was the first time in our country's history where we were able to show equity across all ethnic groups, that we were able to get every to that 80% threshold. And I think that was both, how we say sometimes it's the best of times and the worst of times. The worst of that so many lives were lost during COVID. But
Mhm.
the best came out of it is we now have a model to show how we can get the country to have vaccine equity. So, we addressed the challenges head on. We adapted to strategies as we needed to, and that we're just going to continue to strive to make a positive impact on public health across this country.
Good.
Well, thank you. And that's really interesting. Rosalie, as the local program manager for the Rankin Valley Pittsburgh section, what have you seen in terms of attendance at the vaccination clinics in Rankin, um, Mon Valley, and Pittsburgh?
We've had good participation through, again, as Ms. Moss says, we've partnered with churches and other organizations and worked together to get people out. We've been fortunate enough to partner with some individuals who've been able to offer gift cards. And we've done it in a number of different communities. We've done it in churches. We've passed out flyers all over in churches, seniors high rises, and we've had clinics. We just had our last one in May, where we partnered with a church group, and we partnered with Women's Empowerment Entrepreneur Program, where she was able to provide gift cards, and we were able to disseminate information. We download the information that's provided through the CDC or through our network on. We download materials and adapt it and add it, and we're always passing out information at various community and social events. So we're just trying to share as much information, accurate information. And we also have our members who participate in the monthly meeting where we become good health messengers the first Thursday of every month. So we're just involved as much as possible with our community partners, as well as with our members within our organization who live across the city of Pittsburgh and all of the various communities.
Okay, thank you.
Rosalie, is there financial support available for local chapters to host vaccination or information clinics?
Recipient of one of the many grants. We've been receiving a grant ever since the program started. So we are in our 5th year. We receive our funding annually. And with that funding, we're able to add with other organizations who provide other things like space, gift cards, refreshments, water. And our own organization, our chapter here, has donated items so that we're able to increase not only with the vaccination information. At Thanksgiving time, we
Okay. We seem to have a problem with Rosalie's phone right now. So I'm going to ask this next question to um, Zenobia. Zenobia, what are some of the new developments with the Center for Disease Control that we should all be looking at?
So, if I may, let me jump back and just share with you all the question around the funding in your local community.
Okay.
We have a website called goodhealthwins.org, goodhealthwins.org, and you can go on that site and you can see a list of the organizations that have received funding from NCNW to continue this work in the Pittsburgh area. So there are a lot of organizations. So maybe your National Panhellenic Group or Top Ladies of Distinction, Top Teens, your D9 organizations, a lot of different groups have received funding. So they may too also be able to add to the additional dollars in your respective community. So I would say things that we continue to monitor with the CDC. As I share with you, we, first of all, let's say we're getting ready to go into respiratory season for the fall again. And so we want to make sure that in our messaging, we call it 3 for Me. If you, we want everybody to make sure that you continue to get your COVID vaccines and or boosters, that you get a shot if it's available in your health centers. If you're insured, if you're uninsured, it's called the Bridge Access Program. And you can find that on the CDC's website. So if you don't have insurance, you can get a free COVID vaccine still through the CDC's funding through the Bridge Access Program. And then there's RSV. So that's a vaccine that if you're under 6 months or you're over 65, you want to make sure that you get RSV as well, because those are the triple co-administered vaccines that are available for you. But I would say always go to the CDC's website if you want to stay current on what's going on around vaccines. So, you know, there are measles outbreaks, there's bird flu, all of these other things that you hear about. So the CDC website. And then another one of our immunization partners is called Vaccinate Your Family. So you can go to vaccinatelyourfamily.org, and they will also, it's a great resource to talk about immunizations and where they are available, how to access them, how to learn more about the respective diseases, et cetera.
Okay. Hey, thank you.
Okay. Well, who are the community collaborators and partners of the GHW program nationally and locally?
For me, well,
Yes.
national, we have our NCNW state organizations. So those are comprised, so like you all are part of the Pennsylvania state organization. So a shout out to your amazing state leader, Tamika Patterson. So we have our state organizations where they coordinate the mini grant program through the states. We have national partners like Vaccinate Your Family, Top Ladies of Distinction, Eta Phi Beta, Lambda Kappa Mu. I mean, so there are a large list of those. And then we also have the D9 organizations that are a part of Good Health Wins as well. So that's at the national level and the state level. At the local level, we have seen our groups and organizations partner and do this work with everything you can think of. So whether it be someone's hosting, let's say we just participated in Juneteenth Day events. And so they would have disseminated information at Juneteenth Day. If they are partnering, we had a group up in Northern California just hosted a Super Soul Faith Day up in Northern California, where 22 sections of NCNW came together to host Good Health Wins events across lots of different churches and denominations. We have one group that works on literacy, and they've distributed over 100,000 bookmarks as part of their literacy program. So again, what we've said to our folks at Good Health Wins is that you blend it into what you were already going to do. We've seen people integrate Good Health Wins with their BHRP events. We've seen it work with work that you're doing at the schools, at the Boys and Girls Club, at the churches, at tailgate parties, on HBC campus. I mean, you name it. We have a college ambassador program. We just launched a teen ambassador program. So we say in Good Health Wins, everywhere people stay, play, pay, and pray, we want to make sure that Good Health Wins and immunization information is shared. And if I may put a plug in, this Thursday coming up on July 11th, we are hosting a national back to school town hall meeting. And we're doing it in partnership with the National Association of School Nurses. Thank you for putting that flyer up. So if you have anyone in daycare, or start with pediatric with child care, with if you've got a child K through 8, if you got a child playing sports, someone going to college, someone re-entering college, or working with students, we're going to talk about the importance of what immunizations are needed at each juncture with each group so that we can get much information out as possible and making sure that we keep our family, our friends, our children, and our community immunized.
Okay, that's
It,
fantastic.
it
Um,
is.
how does the Good Health Win monitor low vaccination rates across the country? And what is the remedy to get people to come out and become vaccinated?
So we are very data driven. One of the first things that we do is teach our mini grant recipients how to read the data in their local community, how to connect with their local public health departments. And so you take that local data and then you design your programs around that. So I'll give you an example. Again, last week, we just left the city of Philadelphia and they hosted a pilot community listening session so that we could ascertain what's going on in that respective community around vaccines. What have we learned from? What were the lessons learned from COVID? How connected are we to knowing where the resources are? What are the barriers? So some of the same questions that you asked in the interview, we asked local CBO leaders to come together last Thursday, and we had dinner. We had this community conversation, but the goal is not to stop at the conversation. It is to use that data to decide what can they do to galvanize their community around a potential future project that they would do, and therefore keeping this topic at the forefront of their community. Very, very excited. We would like to bring that program and do our next pilot in Pittsburgh.
Oh,
So all it's going to entail is that 20, 30 community-based organizations come together. Thank you in advance to the leadership of your section for being able to identify the people. And then we're going to come in and have that community conversation with the goal is to use the data in Pittsburgh to drive how Pittsburgh responds to its immunization needs.
okay,
Okay.
sounds great.
Yeah, so you've already answered what my question was going to be, but how successful right now do you think you guys are doing?
So I would say overall, we are very pleased of what we're learning from Good Health Wins. Prior to COVID, many of our groups and organizations were not in the immunization space. And so we now know the value of immunizations. We know that vaccines save lives. We know that, prior to COVID, vaccines have been so successful that you really hadn't seen the diseases. So we were doing really well with measles and chicken pox and all of that. We see a
Mhm.
resurgence of some of those because less people are getting vaccinated. So you're starting to see those diseases again. So one of the things that we're trying to do is to make sure that we use our Good Health Wins platform so that
Mhm.
we can stay ahead of and stay abreast of what's going on. So we've been very successful, not just by the numbers. 2,000 programs is not a small feat, right? Um,
Right.
Right.
Zip codes that we are in. We have 6,000 partners. We have
Wow.
the messenger certificate program. Over 5,000 people have gone through that. But I'll tell you, I am most proud of the work that we've done. We hold what are called community of practice sessions. They're 1 hour meetings where you come in, you learn great information, you can see best of show of
Hmm.
programs are going on across the country. We have those every first and third Thursday. Since the beginning of COVID, next on the 11th, that is actually a community of practice. We generally have anywhere from 750 to 1,000 people on those calls. And
Really?
well, we have gone over the 80,000 mark, more than 80,000.
Oh, wow.
So we say, others say we're vaccine hesitant. We say we're building vaccine confidence. That's
Mhm.
all we're doing, is
Okay,
giving folks the information and make good decisions for themselves.
Mhm. Mhm.
that's great. That is fantastic.
Yeah.
What training is available from the Good Health Wins National Initiative to support the local initiatives?
All right. So as I share with you, the at the national level, our community of practice, they are open to anyone. anyone. You don't have to be a part of Good Health Wins to come and hear this information, because again, the information changes so quickly. We want to make sure that people know what's good information, and then the other piece is where to get information. So one way of doing this is through our community of practice. Another way that we do this is through our Trusted Messenger Certificate program, which again, it's free to anyone who wants to participate. We have 3 more coming up on the next third Thursday of the next 3 months. And then we also have done something very special. We are Ncnw, we're a convening organization. So we're an organization of other national women's organizations. And so we took that model, and last year we launched our first community national EBO summit on vaccine confidence. And so we're going to convene the summit again, December 4th through the 6th in DC. And that too is an opportunity for community-based organizations to really come in and see how they can put immunization on their platform. So for example, if you're a national organization, you might want to, we're encouraging you all to create a resolution to your organization, so that that's how you systemically add this information in. If you're doing legislative kind of work, we're creating a legislative toolkit around immunization. So whether at national, state, or local, we really want to provide people with tactical and practical ways of really helping build vaccine confidence in your communities.
Okay.
That's good. So is the Good Health Wins program, is it only for pandemic related issues?
No. So we started off with it only around COVID back in
Right,
2021.
right.
We have now merged, or really broadened our scope of work to include COVID, flu, and routine vaccines. So working
Okay.
with groups to understand the importance of what shots do babies and pediatric needs,
Mhm.
understanding what you need to have to go to school, understanding, especially if you're 9, the HPV vaccines for boys and girls
Mm.
around cancer preventable vaccine.
Ah,
Understand, let's say we're adults, what vaccines you need as an adult. So not just, let's say if you're traveling, you need to know what vaccines you need, but also think about it. How many people do you know that has shingles? There's
Mm.
a shingle. If you're over 65, there's an RSV vaccine. I mean, just understanding what is available, or just knowing what to ask for is really important. So whether it be the vaccine for children, so if you're a child 18 and under in the United States, most vaccines are free for you, right? It's not the same way for adults. So for adults, you have to know where to go, how to access those vaccines. So we want to make sure that we share that information with everyone. And
Mm.
again, CDC website, Vaccinate Your Family website. You can go to the goodhealthwins.org website.
and in addition to your answer, is there an age limit to start receiving the vaccines, or is there an age limit to stop? If you're 90, should you still get the vaccines?
So we will say this as our disclaimer. Always, always, always talk to your doctor. Your doctor makes the best decision, because every
Right.
person has a different situation. You may have an underlying condition. So you work with your physician. If you don't have a doctor, you try to find a healthcare provider, talk to a pharmacy, but the vaccines are available for all ages and stages. This is not a one and done. It is important to understand the value of immunizations across your lifespan.
Okay.
Mhm.
And you may have already touched on this one, but it's worth repeating. How can someone without insurance coverage access the Good Health Wins vaccinations?
All right. So currently, if you do not have insurance, there is what is called Bridge Access Program. You can go to the CDC's website, and the Bridge Access Program is for uninsured if you don't have insurance, or underinsured if you have insurance, but making sure that your insurance may not cover immunizations if you're in a health system. So one of the things that the CDC has done is to make sure that you can right now you can still go to a Walgreens, a CVS, or a federally qualified health center in your community, and you can still access those free COVID vaccines right now.
Oh, that's great. That is really good.
Now, what type of program, outreach program, do you have to reach the homeless people?
So every organization, or we call these autonomous grants. So depending on your group or organization, we nationally do not have a one size fit all kind of program where people are mandated to do anything. It's the creativity that bubbles up from the ground, and what makes Good Health Wins very special. Are there groups working with homeless populations? Absolutely. Are there any in your community? That probably is a Dr. Smiley question, as I wouldn't know that. But I would say that if you see that there is a large contingency of homeless that are not getting vaccinated, that could be your new initiative,
Mm.
right? Give you an
Okay.
example. I can say I know of a large scale project. We had a group up in Maryland, and they worked with their entire foster care system to make sure that all of those children and their families were able to get vaccines. And we did that through our Uber program. So you saw a lot of big national programs at the beginning of the pandemic. And then as the years have gone on, they've become more and more localized. So thousands of events that are going on.
Right.
Oh,
And,
okay.
okay. And we want to welcome back Dr. Rosalie. Um, we missed you for a few minutes, but one of the questions that did
Hot
come
and
up
it
is,
shut down, so it cooled off and they let me and the log back on. Can you hear me?
yes, we can. Thank you.
Oh,
There were a couple of questions that we talked about, and one was, how does what are some of the things that we are doing as a group, the Rankin Valley Pittsburgh unit, to reach those low vaccinated communities? Can you think of any that are? Go ahead.
yes, we have partnered with different organizations who work with us to create clinics in those communities. We've had several clinics in those communities. We've had lunch and learns in those communities. In their various community events, there have been a dissemination of information and flyers of the materials that we've downloaded, and we've passed out those materials as well. So we partner
Okay.
with different, organizations, whether Divine Nine or private organizations, churches, other clubs and social organizations. We will work with any of those individuals and share what we can, and they share pitch in what they have, which makes our clinics more successful and able to reach more people. Because, as you know, Allegheny County has over hundreds of, when she mentioned zip codes, so many different zip codes we reach, because we have reach across Allegheny County, Penn Hills, all these other
Mhm.
distant municipalities. So we have a large reach of zip codes and individuals that we work with and partner with to disseminate that information wherever we can as much as possible. And so while I heard Alice's question about specifically targeting homelessness, we may have individuals who are working with those particular groups, but our group has not specifically made any outreach to any homeless shelters. But that most certainly can be put on our agenda, and
That's
we
right.
can see if anyone has outreach to them. Because I know we focused a lot on the senior citizen high rises and churches and other social organizations, but specifically, we've also done something with the child welfare system as well. So I think we can most certainly look into that for one of our projects.
Okay.
And
That sounds
also, what
great.
about, let me ask this question. What about the population that's in the Allegheny County Jail? How
Specifically,
would you?
however, we do have several of our members have gone into the Allegheny County Jail with voter registration, and when I'm sure when they take those opportunities, they disseminate information about vaccination as well. So we have a real strong presence in the county jail with a number of our members who help with voter registration and other activities within the jail
Good.
in Allegheny County.
Okay. We
Okay.
have a caller on the line. We have Donna from Homewood who is on the line. Hello, Donna. How are you tonight?
Hello.
Hello.
Hi,
Hi.
Donna. How are you? And
Oh,
welcome to the
good. How
show.
are
And
you?
what question do you what question do you have for our guest today?
Oh, okay. I'm sorry for getting on late, but I'm not sure that this question has been asked before. But we know the elections are coming up, and I'm just wondering if the Good Health Wins program is concerned as to which person gets in and how it will affect the funding for Good Health Wins. Because we know we have two very different people running for president of the United States. So, are there any concerns about that?
So I will say thank you so much for the question. First of all, the National Council of Negro Women, we are a 501c3 nonpartisan organization. However, what we have been doing since 2020, 2022, mid-year, and in 2024, we have a national campaign called Vaccines, Veggies, and Votes. So this year we will make sure that we are providing information around the importance of immunizations during this voting season. We have also we want to make sure that we understand that, again, respiratory season is getting ready to start in the fall. And with the elections in November, we want to make sure that everyone stays safe. This is the last thing we need is another COVID outbreak because people not understanding that COVID is still here. So in our campaign, we try to make sure that our groups and organizations are doing work such as if they are making sure that those who are working the polls that they have protective PPE so that they can stay safe, that while people are canvassing, we want them to be able to share information around the importance of vaccines even during this election season. We know that there may be different views around immunizations. The CDC is very committed to public health, regardless who is in an administration. We have to make sure that public health stays first on the agenda.
Thank you. And
Mhm.
do you have any other questions, Donna?
No, thank you. I just wanted to just wanted to know if there were any concerns. But I guess there's no faction of Good Health Wins that deals with voter registration. They only deal with the aspect of the health issue and not the voter registration. Is that right?
So I would say that we don't take a position on the candidates in Good Health Wins, but I will say that NCNW, we're a social justice organization. So we're very much committed to the work that's going to happen, the campaign, and making sure that our members and people within the Good Health Wins network are informed of the positions of different candidates. But just like our position around vaccines, we it's very important for us to provide information so that people can make an informed choice. And we figure if you give them, like your mama say, you know better, you do better. Try to give them the right information.
That's true. And ladies, Donna, any other questions that you'd like to ask before we move on?
Thank you. I'm finished. Thank
Okay.
you. Good day, everybody.
Thank you. And take care. Okay. So, ladies, as I told you, this hour goes so quickly when we're asking questions. So, we're going to give you, ask if you have any last comments or information that you would like to share with our audience about the Good Health Wins initiative. And um, Zenobia, you want to go first, and then Rosalie, you can follow.
Well, I just can't thank you all enough for utilizing time on this platform because week after week or however often you have this radio or this TV show, you get to select the topic. So thank you for selecting Good Health Wins to talk about the importance of immunizations across the lifespan. Thank you to your leadership in your section, in your state. Thank you for the work that you're doing across the board in all of this amazing work that NCNW does on the ground. There are about 6,300 community-based organizations in the country. NCNW is just one of those 6,300. But you think about the amazing impact that a few of us can have in our cities across the country. So thank you for what you're doing on behalf of children, for those who don't have a voice, for those who don't understand what's going on. We always stand in the gap. I just appreciate all of you all. Thank you, Sister Donna, for calling in. Every question is a good question. And as we say, Good Health Wins, we are better together. So thank you all so much for this opportunity to share with you all this evening.
Thank you. And Rosalie, would you like to add anything?
Yes, I would add that if they are interested in having our group partner with them or have us come and share information, we have people available to come out to disseminate information or even to arrange for a clinic at their site. We have various partners that are available. We partnered with the pharmacy as well as some other private groups. So please just give us a call if you'd like to partner with us or be on the lookout for us at any of the community events coming up throughout the summer. We will be there sharing our information and willing and able to join you in making sure that our community is aware of all of the opportunities and information available about vaccination across the lifespan.
Thank you both so very much. But before we thank our guests for appearing on our program, we would like to say that the Good Health Women's Immunization Network, Good Health Wins, is our commitment to building an army of good health champions. The CDC Bridge to Access program is currently offering free COVID-19 vaccination for the uninsured and the underinsured. You can reach them by calling 412 979 9685. And I'll repeat that 412 979 9685. You can call them for more information. Alice?
Yes, Zenobia and Rosalie, we would like to thank you very much for taking the time out of your busy schedule to inform our audience about the NCNW's Good Health Wins initiative on a national level and locally. It's been very informing.
Yes, it
And I hope our listeners that are skeptical about immunizations and vaccinations will have learned something, because I have.
Right. And we'd also like to thank our listening audience for tuning in. And we invite you to join the National Council of Negro Women by calling 412 867 9641. Once again, you can join us by calling 412 867 9641. And the number is on the screen. And you can get some information about our organization and a brochure that tells you all about our membership. We need your help to advocate and positively impact families and communities in the Rankin, Mon Valley, and Pittsburgh area. Remember, our live program airs on the first Friday of every month at 6 o'clock p.m. And we welcome you and we want you to come and join us both as a member and as a participant. And everybody remember, please get vaccinated. Thank you so much, everyone, and have a great evening.